The Honourable Member for Courtenay-Alberni.
Thank you, Madam Speaker. It's an honour and privilege to rise today to speak about the leading health crisis, certainly in my home province. It's the leading cause of death for those under the age of 59. And Madam Speaker, this is not just close to me, it's close to everyone in my home province, and it's raging across the country, this terrible tragedy of highly contaminated, toxic drugs that are killing people every single day in this country. Over 20 people a day, Madam Speaker, are dying. And I can tell you personally, coming from Vancouver Island and my hometown, the impact it's had on everybody in my community. Nobody where I live is untouched. I can't count on two hands the amount of my friends' kids that have died, never mind friends. It is a really, really terrible tragedy that is happening. And we can do better, Madam Speaker. We hear this huge debate about harm reduction versus treatment and recovery. We have to do both. They go hand in hand. We can't help people who are dead. My good friend from Vancouver East constantly reminds me that we can't help people if they're dead, Madam Speaker. And we need to move forward with policies that are grounded on evidence or evidence-generated policy, Madam Speaker, that are supported with evidence. The evidence says what we're doing isn't working. That's the evidence. That's right across this country, Madam Speaker. That we are now dealing with new substances that are so highly toxic and addictive, Madam Speaker. Never before in our history have we seen such challenging times when it comes to substances that are so dangerous. And they're they're obviously lethal, Madam Speaker, because they're unregulated, they're manufactured by organized crime, they're marketed and sold by organized crime, Madam Speaker. We've had a number of expert reports on how we should respond to this crisis, including the Canadian Association of Police Chiefs, the Expert Task Force on Substance Use, which was created by Health Canada, Madam Speaker, and it was to inform politicians on how to move forward to respond to this terrible crisis. All of them were consistent, and that we need to stop criminalizing people who use substances. It causes more harm. It's a barrier to it's rooted in stigma, Madam Speaker, that we need to create a safer supply of substances to replace the toxic street supply, that we need to scale up treatment and recovery, Madam Speaker, and make sure that we're meeting people where they're at and having those systems in place and ready, that we spend money on education and prevention, Madam Speaker. We have not done that. We have not done that. And I say this all the time. The Liberals taking an incremental approach in a health crisis costs lives. Conservatives spreading disinformation is deadly in a health crisis, Madam Speaker. And we need to move forward and listen to the experts, Madam Speaker. And I'll talk a bit about what's actually happening and the facts about some of the concerns that we're hearing from the Conservatives, because it is their motion today. I will speak to them primarily. They've created a moral panic, Madam Speaker. They're fundraising, Madam Speaker, fundraising off of the tragedies of families. It's absolutely unbelievable. It is so harmful. It is so harmful. If they were truly here, Madam Speaker, to try to help people, they would be bringing forward solutions, concrete solutions. I have not heard that from any of their speeches today. I asked the leader of the official opposition why he wouldn't meet the moms, the mothers of the victims of this crisis. I've sat with them, Madam Speaker, and I've listened to them. And their stories are informed. They know better than anyone how toxic the drugs are. They know better than anyone how hard it is to support someone that's going through the difficult challenges when you're living with a substance use disorder, Madam Speaker, and navigating a system that is completely broken. They know better. And Madam Speaker, we hear the Conservatives in terms of their moral panic that they've created around this issue. And I'm going to talk a little about what's actually going on in Western Canada, where we're hearing primarily from Conservative MPs. Now, my home province in British Columbia, are they doing enough? No, absolutely not. Is any province or territory in this country doing enough? No. But they require a federal partner. Vancouver, British Columbia has been ground zero for over 100 years when it comes to drug high amounts of substance use, Madam Speaker, back to the opioid crisis back in 1908. This is not new to us in our communities, but what is new is the toxicity of the drugs. And it has been challenging because we've been in ground zero facing this terrible tragedy. And when the BC Liberals were in government, in 2014, we went from 7.9 deaths per 100,000, Madam Speaker, to 30.3 in just a matter of 4 years, a 383% increase. From 2017, we actually went from 30.3, and yes, our peak was over 47, Madam Speaker, deaths per 100,000. It is absolutely brutal. And after the last 11 months or 12 months, we've seen an 11% decline in deaths. That's the trajectory right now for British Columbia. Now, I'm not celebrating that, Madam Speaker. It's a relief. This is a tragedy. Every death is preventable. Every single one of these deaths is preventable, Madam Speaker. But we are breathing a sigh of relief that we're heading in the right trajectory. But it needs to go down much quicker, much faster, and we need to come together and work together on that. We went from 7.4 people dying a day in my home province to 6.2. 6 families are going to get a call today. 6 families are going to get a call today. Now, I look at Alberta. The Conservative government got elected in 2019. They had 15 deaths per 100,000. They're now at 41. They are leading the country, Madam Speaker, in terms of death per capita in this country. Their death rate is skyrocketing, Madam Speaker, skyrocketing. And I think about, I'll give you some examples in Alberta. Lethbridge, where they closed the safe consumption site, Madam Speaker. They closed the safe consumption site. Their death rate is 137 per 100,000. Madam Speaker, that's more than triple that of British Columbia. Medicine Hat is 63.7, over 50% more than British Columbia. We see reports in the news about Fort McMurray, record-breaking year. Madam Speaker, if we don't have safe consumption sites, then guess where people use? They use in the public, they use in the back alleys, they use in the bathrooms of businesses, and they die at home alone. And we know that's deadly when we have a toxic drug problem, Madam Speaker. And I speak about Saskatchewan, and we constantly hear from members, whether it be from Lethbridge or Fort McMurray, pointing the finger at British Columbia. I'm not doing that right now. I'm just trying to bring some facts so that we can actually have a proper conversation, Madam Speaker, and I'll get to that. But in terms of Regina, the member from Regina, Capel, pointing the fingers at British Columbia instead of coming here to fight to help people in Regina. That is a failure, Madam Speaker, while people are dying in his community. The death rate in his city is 66. This is straight from the Regina police force, okay? So these are 2 Conservative provinces, Madam Speaker, leading the nation in terms of death rates that are skyrocketing. We can look to Alaska, a Republican state. 45% increase last year, Madam Speaker. No harm reduction, no safe supply, no decrim, and those 2 provinces in that state. So when they want to point the fingers at safe supply, they want to point the fingers at decriminalization, what's happening in their provinces with their one-track recovery-only model, where they fail to listen to the experts? They talk about wacko. What's wacko, Madam Speaker, is when you ignore experts, when you ignore evidence, when you ignore science, when you ignore the facts. That is wacko, Madam Speaker. And Madam Speaker, in the U.S. under Donald Trump, 30 states doubled, in terms of toxic drug deaths under Donald Trump. 30, Madam Speaker. But they want to say it's British Columbia, it's an NDP thing or a Liberal thing. This isn't an NDP, Liberal, Conservative thing. This is a societal issue, and the problems And the solve is not going to be based on ideology. It has to be grounded in evidence, and it has to be supported by the experts and led by the experts, not by politicians. I can't think of another health crisis where politicians are deciding how we move forward, Madam Speaker. So this is an issue that we know has been chronically underfunded. The Liberals have spent less than 1% responding to the toxic drug crisis, Madam Speaker. Less than 1%. Why? Because of the stigma. Are the Conservatives helping contribute to the stigma? Absolutely. Absolutely, Madam Speaker. And we need to get away from that harm, Madam Speaker. We need to make sure that we listen to the experts. Now, when we talk about safer supply, you hear about safer supply. Well, safer supply, the whole concept of it, Madam Speaker, is to be brought in to replace the toxic drug supply. This is recommended by the Police Chiefs Association. The Law and Order Party doesn't want to listen to the police, Madam Speaker. The police testified at Health Committee. They said that 85% of poison drug deaths are from fentanyl. Cocaine was found in the bloodstream. But they said hydromorphone, safer supply, is not what's killing people. In fact, traces of it showed up in 3% of the toxic analysis of toxic drugs in British Columbia. That prescribing pharmaceutical alternatives to toxic street drugs separates people from toxic street drugs and helps them stay alive so they can stabilize their lives and connect to treatment and care. And there is no way to know the source of drugs purchased on the streets right now, even if a dealer claims it's from prescribed alternatives program. The chief coroner of BC has indicated we're not seeing an increase in deaths amongst youth or an increase in diagnosis of opioid use disorder, despite the claims of the Conservatives. And the goal of prescribed alternatives program is to help people at the highest risk of death or harms from the illicit poison drug supply stabilize their lives, Madam Speaker. Safer supply has not increased the number of people with opioid disorder. In fact, we've seen reductions in all-cause mortality and overdose mortality. We've seen reductions in overdose and use of unregulated opioids, those on safer supply, a decline in healthcare costs and fewer hospital visits, increased engagement in healthcare and social services, improvements in physical and mental health, improvements in social well-being and stability, reduced use of toxic drugs from the unregulated street supply, improved control over their drug use, reduced injection, reduced involvement in criminal activities, and the diversion of hydromorphone is not contributing to opioid-related mortality. In fact, we've heard that for those receiving safer supply through the Safer Supply program, the risk of dying from any of those causes was reduced by 61%, and risk of dying in overdose was cut in half. If they received 4 days or more, their overdose risk was further reduced by 89%, Madam Speaker. And I want to go back to who's impacted the most. Well, Madam Speaker, Indigenous peoples are impacted the most. The opioid epidemic and toxic crisis are yet another example of the large gaps in healthcare outcomes between Indigenous and non-Indigenous people. Indigenous people are disproportionately affected and multiple times more likely to die from toxic drugs. They're 7 times more likely to die in Alberta, 5 times more likely to die in British Columbia, and in some Indigenous communities, that can skyrocket to as much as 36 times more likely than the general population. We just heard that at Health Committee the other day. And I'm going to read a quote from Dr. Judith Sayre. She's the Newchannel Tribal Council president. She sits on the BC First Nations Justice Council, and she says, "We want to work with the province in tackling the crisis and be part of a collaborative strategy. But the BC First Nations Justice Council stands with our partners in healthcare and asserts the toxic drug crisis needs to be treated and addressed as a public health issue, not a criminal justice issue. The criminal justice system is not the solution to a problem that instead needs to be addressed through healing." We've got to stop this colonial approach and listen to Indigenous people who are more likely to die, Madam Speaker, from this crisis. And from the police, who again, the Law and Order Party wants to ignore, the Deputy Commissioner of the Royal Canadian Mounted Police, he cited, quote, "As noted in some of our supervised consumption sites or overdose prevention sites, there are no inhalation rooms, there is no ability to inhale. We find that most of our overdose deaths are related to fentanyl and to inhalation, so we need to provide spaces. I think that would allow for that, but it can't be a space where someone has to take a bus for 4 kilometers and go across the city to find that space. Those spaces need to be readily available. This is against the Lethbridge model, Madam Speaker. And I'll talk about Fiona Wilson. She's the president of the British Columbia Association of Police Chiefs. She's the deputy chief of the Vancouver Police Department. She cites that 85% of overdose deaths are attributable to fentanyl. That's what people are dying from, according to the coroner's data. They're not dying from diverted safe supply. They're not actually dying from diverted prescription medicine. She said the reality is that there are 7 people per day in British Columbia that are dying as a result of the toxic drug crisis. They are not dying as a result of prescription diverted medication. They are dying because of the poisonous drug supply on our streets. And lastly, she says, we do not want to criminalize people by virtue of their personal drug use. Those days are gone. We want to support a health-led approach, and we strongly support the notion of not trying to arrest ourselves out of this crisis. That is not going to save lives. In fact, it does quite a bit of harm. That's from the police. Madam Speaker, I know I've only got a few minutes left, and I'm going to talk about going to Portugal. I went to Portugal last summer on my own dime, and I was very fortunate to have the Embassy of Portugal line up a deep dive itinerary so I could go there and learn. And Madam Speaker, why did I choose to go to Portugal? My good colleague from the bloc talked about Portugal, and I really appreciate his insight. But I went there to learn from them. They had a death rate of over 1,000 people in a population of only 10 million, primarily from intravenous drug use. Heroin, as we know, was just impacting their community. They had over 100,000 chronic daily heroin users, Madam Speaker, and as my colleague cited, over 1 million people had tried heroin. And they were able to bring their numbers down to 23,000 chronic users. They brought their numbers of deaths from 1,000 to 60, Madam Speaker. So I thought it was prudent for me to go and learn and listen to them. This is how they responded to their health emergency when they decided to treat it as that instead of a criminal issue. They went from 250 people using methadone to 35,000 in 2 years. How did they do that? They engaged the military to build labs, Madam Speaker. They engaged the military to do that so they could reduce the price, so they could get those labs up and running, so they could save lives. That's how you respond in a health emergency. They built treatment facilities right across the country so that there was no wait. No barrier treatment, Madam Speaker, covered under the universal health care system, not like the Alberta model, Madam Speaker, where you can, good luck getting treatment in Alberta in a short period of time. It's not going to happen. We're heard loud and clear from witnesses, including Petra Schultz from Mom Stop the Harm, who talked about the gaps in their system. And there is gaps in our system. They also spent a lot of money in recovery, because we know relapse is part of dealing with recovery, Madam Speaker. So they caught people when they landed, but they invested in a 4-year follow-up cycle when people came through treatment, because we know connection is a deep and important part of it, and dealing with the underlying trauma. They made sure people had housing, Madam Speaker, and they decriminalized and treated it as a health issue. Now, you hear my title as the NDP critic for mental health and harm reduction. Well, harm reduction we don't just see as safe consumption sites and safe supply. Those are critical components. But housing, all the different social determinants to health, that is reducing harm, Madam Speaker. Our goal should be to reduce harm. But in terms of, we hear the Liberals talk about, meeting the moment. Well, they didn't respond like Portugal. They haven't moved in an expedient way. We need a coordinated, integrated, compassionate approach like Portugal. They created their expert task force, Madam Speaker. That expert task force morphed into the oversight body for government to move forward. And I'll tell you where the politicians were heroes. You know where the politicians were heroes in Portugal? They got out of the way. They decided it was a health issue, and they let the experts lead and move forward with their policy and implementing it. The politicians' role was to make sure they had the resources to do it. That was the job of the politicians. We're not doing that, Madam Speaker, today. And we need to get to that point, because we know, Madam Speaker, over 20 people are going to die today. Over 20 moms are going to get a call. It needs to stop. The disinformation, the fundraising, the moral panic, it needs to stop. They need to meet with the moms The Conservative leader is the only leader that refuses to meet with Mom Stop the Harm. He can't explain himself. They are informed, Madam Speaker. And this Liberal government, they need to treat this and meet the moment, Madam Speaker, like they say. They need to scale up resources and meet the moment. Thank you, Madam Speaker.
Resuming debate.